Welcome to County Portal, your simple source for local government services and public records. Let's get started.
The story linking Kamala Harris's grandmother, Rajam, to reproductive healthcare in India is more nuanced than a single famous anecdote. It's about a confluence of family values, historical context, and the subtle but profound influence that shaped a future vice president's views on women's autonomy. Kamala Harris often speaks about her maternal grandparents, P.V. Gopalan and Rajam, who lived in Chennai, India. Her grandfather was a high-ranking civil servant, known for his progressive thinking and support for women's education and rights. Her grandmother, Rajam, was a strong, educated woman herself, a homemaker who managed a bustling household and was deeply involved in her community. Their home was a place where discussions about social justice and equality were common, and this intellectual environment deeply influenced their daughter, Shyamala Gopalan, Kamala Harris's mother. Shyamala went on to become a pioneering breast cancer researcher in the United States, dedicating her life to understanding hormones and their role in cancer, which is a direct link to women's health. While there isn't a specific, widely publicized account of Rajam personally leading a reproductive healthcare movement in India, her life unfolded during a pivotal time for women's health in the country. India was one of the very first nations in the world to implement a state-sponsored family planning program, starting in the 1950s. This initiative was largely driven by concerns about population growth and national development. It aimed to provide access to contraception and information, though its implementation had complex and sometimes controversial aspects over the decades, particularly during periods like the emergency in the 1970s. Rajam, as a woman living through these times, would have been acutely aware of the societal discussions around family size, women's roles, and health. Her family's progressive outlook meant that discussions around bodily autonomy and the well-being of women were part of their ethos, even if not framed exactly as reproductive healthcare activism in the modern American sense. Kamala Harris herself has often emphasized the values instilled by her grandparents, the importance of public service, fighting for justice, and believing in the potential of every individual. Her mother's scientific work on breast cancer further cemented the family's dedication to women's health. Therefore, the story is less about a direct historical event involving Rajam and more about the enduring legacy of a family that championed education, progress, and women's well-being in a society grappling with significant social change. These foundational influences from her grandmother and the broader family environment in India undoubtedly shaped Kamala Harris's strong advocacy for reproductive freedom, access to comprehensive healthcare, and the right to bodily autonomy that she champions today in the United States. Her commitment to protecting and expanding reproductive rights can be seen as an extension of these deep-rooted family values and the historical context of women's health in her ancestral homeland. Thank you for watching this deep dive into the historical influences behind Kamala Harris's views. If you found this information insightful, please consider subscribing to our channel for more content that explores the intersection of history, politics, and personal narratives. Your support helps us continue to bring you these important stories.